Friends, in this topic of basic ECG, today I will talk about second degree Mobitz type 2 heart block. It is also called Hay block. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Mobitz II block is a form of second degree heart block in which there is intermittent non-conducted P waves without progressive prolongation of the PR interval. In this, the PR interval usually remains constant and there is no progressive prolongation of the PR interval, and intermittently we have non-conducted P waves. Non-conducted P waves means P wave will not be followed by the QRS complexes. In this ECG we can see with the arrow it indicates dropped QRS complexes, that is non-conducted P waves. Other features which are seen in second degree type 2 Mobitz heart block are PR interval in the conducted beats remains constant. The P wave march through at a constant rate. The RR interval surrounding the drop beat is an exact multiple of the preceding RR interval, that is double the preceding RR interval for a single drop beat, triple for two drop beats, etc. In this ECG we can see this non-conducted P wave, and here the RR interval, that is both sides of this non-conducted P wave, it's almost 3 times the previous RR interval, because there we see here in this ECG we see two non-conducted P waves. So when we have two non-conducted drought beats, the RR interval will be triple for the preceding RR interval. So coming to mechanism of type 2 Mobitz block, it is usually due to failure of the conduction at the level of His-Purkinje system, that is below the AV node. But in Mobitz type 1 it was due to functional suppression of the AV conduction due to drugs, reversible ischemia, and in Mobitz II it is more likely due to structural damage to the conducting system, that is the infarction, fibrosis or necrosis. Patients typically have pre-existing left bundle branch block or bifascicular block, and the second degree AV block is produced by intermittent failure of the remaining fascicle, that is bilateral bundle branch block. In around 75% of the cases, the conduction block is located distal to bundle of His, producing a broad QRS complexes. And in remaining 25% cases, the conduction block is located within His bundle of Purkinje system, producing narrow QRS complexes. Unlike Mobitz I, which is due to progressive fatigue of the AV nodal cells, in Mobitz II there is all or nothing phenomena whereby the His-Purkinje cells suddenly and unexpectedly fail to conduct a supraventricular impulse. There may be no pattern to conduction blockade, or alternatively there may be fixed relationship between P wave and the QRS complexes, that is 2:1 block or 3:1 block. The causes of Mobitz II second degree heart block are anterior MI, that is due to septal infarction with necrosis of the bundle branches, idiopathic fibrosis of the conducting system, that is Lenegre-Leves disease, cardiac surgery, especially surgery which is close to the septum, that is the mitral valve repair, inflammatory conditions like rheumatic fever, myocarditis, Lyme's disease, autoimmune disorders, SLE, systemic sclerosis, infiltrated myocardial disorder like amyloidosis, hemochromatosis, sarcoidosis, hyperkalemia, beta blockers, calcium channel blockers, digoxin, amiodarone, they can all produce Mobitz type 2 second degree heart block. Mobitz type 2 second degree heart block is more likely than Mobitz I to be associated with hemodynamic compromise, severe bradycardia, and further progression to third degree heart block. Onset of hemodynamic instability may be sudden and unexpected, causing Stokes-Adams attack or sudden cardiac death. The risk of asystole is around 35% per year. Mobitz II mandates immediate admission for cardiac monitoring, backup temporary pacing, and ultimately insertion of a permanent pacemaker. JT Scrubs has said, "May the best thing to do is to stop trying to figure out where you are going and just enjoy where you are at." With this, I conclude my today's topic. Thank you. Keep learning.